Okay, so picking up where we left off, the knee through the tib fib, we're going to stop at the ankle. So looking here, we'll go through the diagram first. We have the femur, the lateral condyle, tibial spine, the fibula, tibia, medial plateau, medial tibial plateau, I should say, and the medial condyle with the patella. So we're looking here at the CT3D. Here's the femur, medial condyle, medial epicondyle, medial condyle with the tibial plateau with the tibial tuberosity, fibula, the intercondylar eminence or tibial spine. I'm fine with either one. Here's a lateral condyle, the apex of the patella. Here's your lateral epicondyle and the base of the patella. So here's a CT, and you can see the patella here and the patellofemoral joint with the patellar surface is the line, so you can see where it articulates. You have the medial condyle, the intercondylar fossa with the lateral condyle. We have the quadriceps tendon with the patella. This is MRI T1. We have the lateral condyle with the this is the lateral collateral ligament right here, and this is your ACL with your PCL and your intercondylar fossa, your medial condyle, and your medial collateral ligament. Here is your lateral epicondyle. This is your lateral condyle, medial condyle. Coming across here is your intercondylar fossa with your tibial spines and your lateral tibial plateau. You know that because there's your fibula. And here is your medial epicondyle. So that's a coronal slice. It's a coronal T1. This is a sagittal T1. Here's your quadriceps tendon with your patella. And here's your femur. And what are we looking at here? Oh, this is your lateral meniscus posterior horn. And this is your lateral meniscus anterior horn. So there's the anterior and posterior. Okay, so good review here. We have the medial condyle. We have the medial tibial plateau with the lateral tibial plateau with your intercondylar eminence. The head of your fibula, here's your fibula with your fibular notch and your lateral malleolus with your malleolar fossa and your articular surface with your medial malleolus. Coming up, you have your tib fib or your tibia and your interosseous membrane, just like in your forearm, you have the same thing. So we have your articular surface, your lateral malleolus, your distal tibiofibular joint with your fibula coming up, and you have your proximal tibiofibular joint with your lateral condyle and your eminence there. So looking here, we have your ilium with your acetabulum, your femoral head, femoral neck, greater trochanter with your femoral shaft coming down with your medial epicondyle with your medial condyle, and your lateral femoral condyle with your lateral epicondyle. So we are down lower, so you need to look to see where we're slicing. So this is the axial T2, and we have your patellar ligament with your infrapatellar fat pad. So there's a pad of fat back here to protect your knee. You have your medial meniscus anterior horn, your medial tibial plateau. I want you to know your sartorius muscle is here, your posterior cruciate muscle, or ligament, sorry, it's not a muscle, your popliteal vein with your popliteal artery, you can see the lumen there. Your anterior cruciate ligament is there. This is your lateral plateau and the lateral meniscus anterior horn up front. So quadriceps tendon, you have your lateral collateral ligament. Here's a good shot of your ACL, here's your PCL, and your medial collateral ligament. So we have your tibiofibular articulation with your tibia, your popliteal artery, you can see it barely right there, and your fibula. So looking here, this is good of the meniscus. So we have your anterior horn of your lateral meniscus on your lateral tibial plateau, and you have your medial tibial plateau with the anterior horn of your medial meniscus. You have your medial meniscus here, and this is the posterior horn back here of your medial meniscus, and this is of your posterior horn of your medial meniscus, and this is your posterior horn of your lateral meniscus on your lateral meniscus piece right here. So you can see the darker right there is your meniscus. So here is your patellar ligament. You can see we're down low, and you have your tibial tuberosity on your tibia with your popliteus muscle, and you have your popliteal artery. Your vein you can't see real well. Here's your fibular head, and your articular fibular surface is there. Here's a sagittal T1. So your femur, and then your patellar articular cartilage right here. And this is a great shot of your PCL. Now the PCL runs this way, your ACL runs this way. So this is your PCL right here, posterior. Think of it that way. It anchors down posteriorly, so PCL. So here's your tibia, here's your tibial plateau, your patellar ligament with your apex and your base of your patella, and your quadriceps tendon. So this is a CT reformatted into the sagittal plane. So we have your femur, your patella, your tibial tuberosity with your tibial shaft. You have your talus, sinus tarsi with your calcaneus as we get down into the ankle. And this is your patella. You have your base and your apex. That's the most important part. So here's your lateral facet, your medial facet with your lateral condyle of your femur, your intercondylar notch with your medial condyle. Here's a good coronal shot of coronal T1, your lateral collateral ligament, and here is your medial collateral ligament. We have your lateral meniscus, and your PCL is right there, and this is your medial meniscus. So gastrocnemius muscle, you have your medial femoral condyle, your medial meniscus, posterior horn. So we're cutting further back, as you can see. So this is your posterior horn, your intercondylar eminence, your lateral collateral ligament right there, your tibia, your popliteus muscle. Here's your fibula, your lateral collateral ligament coming up. You have your lateral meniscus posterior horn, and here is your posterior, I won't make you know that, never mind. And your biceps femoris coming down. So looking at the sagittal T1, you can see that we're cutting through on opposite sides. So here is your semimembranosus muscle with your gastrocnemius muscle coming down. We have the, what I want you to know, the medial meniscus posterior horn. Here's your popliteus muscle right along here. Here's your tibia. And I want you to know your medial meniscus anterior horn, and your femur, and your vastus medialis. So over here is your cruciate ligament, your, what are they calling this one? This is the lateral meniscus posterior horn and the lateral meniscus anterior horn. This is your quadriceps tendon. So looking where we're cutting, we're down here by the base. So we have your patellar ligament, your medial meniscus anterior horn, so it's the darker portion. This is your medial femoral condyle. Your medial collateral ligament is right there, that black stripe. Medial meniscus posterior horn. You have your posterior cruciate ligament, your semimembranosus tendon right here, your popliteal artery with your gastrocnemius muscle, and your the medial and the lateral head. So I also want you to know your, let's see, oh, your lateral collateral ligament and your lateral meniscus posterior horn, and here's your lateral meniscus anterior horn, and this is your infrapatellar fat pad. So you can see the fat is the same here, so this is a T2 fat sat, so axial T2 fat sat. So you can see the fat is the same density. So looking here, we have your vastus lateralis muscle with your femur, your quadriceps tendon, your popliteal artery back there, your vastus medialis with your sartorius, semimembranosus muscle, and your biceps femoris. Looking over here, we have your lateral patellar reniculum, so it keeps it in. Here's your patellar femoral joint space, and you have your mediopatellar reniculum right there. It keeps the patella anchored where it's supposed to be. Here's your mediofemoral condyle with your gastrocnemius muscle, with your anterior cruciate muscle and your ligament, and it's right, runs right along here. That's it right there. And then your mediofemoral condyle. So posterior cruciate ligament. On CT, it's almost impossible to see. Here's your PCL, ACL, and your medial condyle, your medial tibial, well, here's your tibial collateral ligament, sartorius, popliteal artery. So this is a angio that we're running CTA, plantaris muscle, and your gastrocnemius muscle. So here's your biceps femoris, your popliteal tendon. Hard to tell that that's a tendon. I want to ask you on a test. Here's your lateral condyle and your IT band right there. So your quadriceps femoris, you can see your vastus lateralis, rectus femoris, and vastus medialis, and then the rectus femoris goes into your tendon of your quadriceps. So you have your medial-patellar ranunculum, what we talked about there. Here's your medial collateral ligament coming down here, and here's your lateral collateral and your lateral patellar ranunculum and your patellar ligament. So it goes rectus femoris to the tendon of your quadriceps, to your patella, to your patellar ligament, so to your tuberosity. So gastrocnemius, here's your medial head, your lateral head on the other side. Over here, we've got your tibial collateral ligament. So you can see here is your posterior meniscal femoral ligament. Right here is your PCL, so it's coming down. Your lateral meniscus here, they're calling both sides the lateral meniscus, which is interesting. So this side should actually be medial, right? Because here's the fibula. So that's not right. Here's your semimembranosus tendon and your popliteal. And we've got your patellofibular ligament coming across here. There is your fibular collateral ligament. Okay, so looking at this, the one thing I wanted you to see is this is a CTA. You can see the popliteal artery there. So this is a sagittal T1 of the knee. So we're looking at, remember how I said the PCL, it attaches posteriorly. So here's your PCL, comes up. Here is your ACL. So it attaches anterior and attaches in the back. So that's important that you see that. Here is your gastrocnemius muscle. This is your popliteus muscle and your patellar ligament here. Quadriceps tendon. I want you to know your PCL. You can see it well there, and here's your patellar ligament. Quadriceps tendon, lateral collateral ligament. Here's your biceps femoris. And we have your plantaris muscle with your gastrocnemius muscle, lateral and medial, and your PCL is there in your medial collateral ligament. So deconstructed knee, you can take a look and just get a lay of the land on how it all fits together to help you figure out where you're at. So you have your medial femoral condyle, and here's your fibula, and back here is what we call popliteal cyst. It can also be called a Baker cyst. A lot of people have them. It's just a tear in the meniscus where the fluid leaks out. So not a big deal. People live with them for years and years and years. Looking here at the muscles, we have the head of the fibula with the patellar. So we have your extensor digitorum longus. Okay, they come all the way down. So you have your tibialis anterior here, your extensor hallucis longus. I want you to know, we're going to get into all this when we get down into the ankle, so I might as well introduce it to you now. The flexor hallucis longus, the peroneus brevis, and the peroneus longus. So here, the soleus muscle is right here, and then this is your gastrocnemius. Oh, I didn't do these ones. So your gastrocnemius, here's your tibia, your soleus, your extensor hallucis longus, and I want you to know your extensor digitorum longus, tibialis anterior, and this is your fibularis longus. So looking here, you have your tibia, your fibula, you have a little interosseous membrane that holds the two together. Whenever there's two bones next to each other, there's always that interosseous meshing, keep them together. So there's the tibialis anterior, the extensor digitorum longus, the peroneus longus. We have the soleus and the gastrocnemius, and we have gastrocnemius lateral head and medial head. We have the plantaris is here, We have the popliteal artery and vein with the tibial nerve that runs right down by it. Here's your popliteus muscle. I want you to know, that's good. So tibia, fibula, interosseous membrane, tibialis anterior, extensor digitorum longus, extensor hallucis longus. We have your peroneus brevis, peroneus longus, coming back to your flexor hallucis longus with your soleus muscle and your gastrocnemius. So as we get down lower, your gastrocnemius gets more narrow and wider. So that's one way to tell where you're at. Okay, oh, the one thing I missed on here was the flexor digitorum longus. So you can see the extensor digitorum longus and the flexor digitorum longus. So looking here, you have arteries and veins that run anterior. Looking at the muscles, we have the extensor hallucis longus with the extensor digitorum longus, and coming around we have the peroneus longus and brevis with the flexor hallucis longus. So flexor and extensor. You have flexor digitorum longus and the tibialis posterior tendon. So flexor digitorum longus, here's the extensor digitorum longus, extensor hallucis longus by the flexor hallucis longus. So they're opposite sides. Just so you know, this is too much and it's really hard. So what you'll want to do is you want to bring your book and make sure that you're going to be able to label these going forward. So here's your tibial tuberosity with your tibialis posterior muscle, the head of your gastrocnemius, your posterior tibial artery with the lateral head of your gastrocnemius. Your soleus muscle is here. Here's your fibula and your extensor digitorum longus. So extensor hallucis longus, your anterior tibial artery, and here's your tibia. I want you to know, here's your greater saphenous vein. So we harvest that if a patient's had a heart attack, and we'll go ahead and take that out and put it in the heart. So here's your posterior tibial muscle. And I want you to know your flexor hallucis longus, your soleus muscle, your Achilles tendon. So your gastrocnemius goes down into your Achilles tendon. Here's your fibula, your peroneus longus, peroneus brevis, and your extensor digitorum longus. So extensor hallucis longus, anterior tibialis muscle and tendon, both there. So here are your posterior tibial vein and artery, your Achilles tendon, your flexor hallucis longus with your peroneus brevis, and your tendon of your peroneus longus. So your extensor digitorum muscle is there. And your tendon of your extensor digitorum. Hard to tell on that though. So looking here, we have your gastrocnemius medial, and we have your sartorius here, your gracilis tendon, your popliteal muscle, your tibial nerve is running right through there, so your popliteal artery, your gastrocnemius medial head is here, your soleus muscle, and we have an artery coming down here. So you have your flexor hallucis longus with your Achilles tendon and your calcaneus. So this is posterior. You have your lesser saphenous veins, peroneus longus and brevis tendons coming down right here. So those are those guys right there. You have your artery, you have your fibula, peroneus brevis, and your peroneus longus with your popliteal vein. Fibular collateral ligament, here's your tibia, and that's pretty good for that one. Okay, so looking here, we have your medial femoral condyle with your PCL and your ACL, and here is your sartorius muscle. And I want you to know your tibia, your popliteal or popliteus muscle, your gastrocnemius, this is your medial. Here's your soleus, your flexor digitorum longus, your tibialis posterior, your flexor hallucis, that's hard to see, but here's your tibia, your fibula, your calcaneus. This is actually your lateral malleolus. Extensor hallucis longus muscle and your extensor digitorum longus. Here's your head of your fibula, your lateral meniscus. That's pretty good for that one. So looking at a sagittal here, we have this is a Sag T1. We have your lateral meniscus, your popliteus muscle, and your gastrocnemius back here with your popliteal artery coming down. Here's your flexor digitorum longus with your soleus and your flexor hallucis longus here. That's hard to see. We'll see it on the ankle. So here's your tibia, and your tibialis posterior muscle runs right back along there. You have your patellar ligament and your fat pad right back there, interpatellar fat. So this is cutting lateral. So you have your biceps femoris tendon, your gastrocnemius. Okay, so sorry about that. Let's start over. So the biceps femoris tendon, we have the gastrocnemius lateral head coming down here. Here's your soleus muscle. And the peroneus longus, we have your extensor hallucis longus and extensor digitorum longus muscles, your tibialis anterior tendon with your fibula and your tibialis anterior. So your anterior tibial artery is right there. Oh my goodness. Okay, so you have your biceps femoris and you have your gastrocnemius and the head of your fibula, your soleus muscle, and you can see where it's cut out there for your gastrocnemius. So your peroneus longus here and your peroneus brevis is there, and the tendon of your plantaris. So you can see your plantaris right there, and here's your tendon coming down. This is your Achilles down here. The main thing is I want you to see your popliteus buried in there. All right. Oops, I always forget the other side. So here the vastus lateralis, bicep femoris. Here's your plantaris, your gastrocnemius. You've got your gluteus gastrocnemius tendon coming down to your Achilles. So cut away even further. You have your plantaris with your gastrocnemius, your soleus muscles cut away so you can see down in here. Here's your peroneus longus, your flexor hallucis longus, your flexor digitorum longus coming down. And that wraps it up for the knee through the tib fib. And then we'll pick up and we'll cover the ankle and the foot.